there's huge opportunity here to kind of reevaluate what we value as a country and as a city. And where are we going to put our investments? Are we going to invest in our people and our industries to make sure that they can thrive and withstand, economic disaster? Or are we just going to keep sitting on our hands and say, well, it's likely that this won't happen again. We'll just kind of kick the can down the road. And that's what we have seen over and over and over again, is just kicking the can down the road. And, kind of talking about intentions, but not really delivering on them.
Sure. Respect. Have you looked at our public health budget for for next year?
I have, but it's been a little while. What specifically was?
Well, we haven't. Our goals in terms of how much we're projecting to spend on public health is literally the same as it was last year when we went $9 million over budget because of this. And if you're in a pandemic, and look, the fact of the matter is we give a lot of money to the Wuhan lab. Viruses and plagues come out of China on a pretty consistent basis. Not to go into China or anything, but pandemics could very well be a thing of the future within the next decade. And we're doing nothing to plan for future pandemics to help increase hospital capacity.
Pandemics are kind of, like I said, they've been over the course of history. They're not new. They are going to your point, they will become more frequent the more that humans have contact with animals, because that's where they come from.
Yeah, or they get made in laboratories, but that's another. That's
another point of disagreement.
That's another topic of. I mean, I have a lot of friends who are doctors and have medical degrees and whatnot, and they've. I'm not the only one who's been saying this.
Okay. I mean, we disagree on this.
Yeah, fine. And there was a bunch of emergency travel nurses that were that I was giving rides to for a little bit and trying to see what things were like in August. And half these nurses that I was giving rides to, they were more worried about Bill Gates than they were about the virus. And these were nurses, these were FEMA nurses that I was talking to that were telling me straight up that they're more worried about Bill Gates than they were about the virus. So I think that there's a lot of conflicting opinions about this, and it's not just from a bunch of conspiracy theorists and scientists. You know what I mean? It's people in the health community are conflicted about this also, and it's not being talked about.
Agreed. It's a hotly debated topic.
Hotly debated topic.